Hey there, and welcome to That's Audacious, where we share entrepreneurial stories from amazing leaders to inspire and motivate you to be bold, brave, and audacious. I'm your host, Lauren Clement, the brand navigator, here to share stories that will make you say, well, that's audacious. Hello and welcome to another episode of the That's Audacious podcast. We have the fabulous Karen Perks with us here today. Now, I've known Karen for a while. She does extraordinary things, but we want to talk specifically today about her award-winning journey as the founder and CEO of Mikare Health. And you've got an extraordinary story behind how you even came up with that amazing solution, Karen. So tell us, where did you come from and why do you do what you do?
Firstly, hello, Lauren, and great to be here. The story behind Mikare Health started because my daughter was misdiagnosed by 30 doctors, and it was left to me to actually find out where the underlying issues were. And I came home one night, absolutely exhausted, another night in the hospital, and watched a TEDx talk on a cardiologist in the US who was using AI to solve unsolvable cardiac cases, and having and then using that process and getting cardiologists to also at the same, so running two teams to see who could convert or solve these problems. The AI actually had higher results than the leading cardiologists, and it was at that point I went, oh my God, I need to be using AI, because I've been collecting data about Michaela. We'd been using AI in the business, my other business, for 3 weeks after it was launched. So it was nothing new. I just hadn't thought to apply it to solving my daughter's health. From that point, within 6 weeks, I had it shortlisted down to the 2 organs and able to get a clinician to go, yep, let's investigate this further, which is their job. Like, that's their job to do that. But Michaela was having, she had 200 seizures over 10 months. She was unconscious for 22 to 24 hours. And we were left, talk about loneliness, we were left to navigate the problems. And then the doctors were, well, this is her life from now on. And I was, as a mother, determined, no, because you haven't done your job properly in the first instance. So, I see AI as a savior to our family. Like, I can't, for me to say I'm passionate about AI, when it saved my daughter's life, then, and every day Michaela she was dying just in front of my eyes. It was really bad. So I look at AI as just the newest tool that started from the Industrial Revolution. Like, we talk about innovation in businesses, innovation in life. And you can't just say that AI is the defining moment of our generations, because there's been so many over the decades and centuries where there's been inventions and innovations that have then driven, the railroad, for example, is one, and cars too. If they want to dish AI, then go back to riding a horse. But with the cost of fuel, that's probably not a bad option these days. So that was my, and so at that point, after Michaela was getting better, I wrote a book called Mum, Please Help Me, because when I was in the hospital, there was one night, and it was, I think I was listening to Tim McGrath's song, Humble and Kind, and one line is, where you get where you're going, turn around and help those behind you. So I kind of stuck onto that because I think that was the only inspiration I had. So I wrote the book, and then I realized that it wasn't enough. I couldn't make enough change. So then I thought, all right, we need a practical product and that people can use themselves, and we can teach them why and how. It's not a complex product, but and it's we've uncovered the holy grail of the missing link between clinicians and patients. We've been able to solve, firstly, cognitive bias of clinicians, where they have this preconceived thought. And let me just jump there. 18 years before this, Michaela was 6 weeks old. I could not lift her out of her cot. I was getting sicker and I couldn't work out why. I went to the 7 doctors in 7 days, and I never went to the doctor because I never got sick. And it was always, you've got a young baby, you've got 3 kids, you've had a cesarean, you're just tired, go home and rest. You know, mindfulness wasn't a thing in those days. Exactly the same thing, words that they were saying to Michaela 18 years later. You're 18, it's typical for this age group, you're a woman, try some mindfulness. And I had flashbacks to, like, my God, you're saying the same thing and not actually investigating. So that was a trigger as well, that nothing had changed. So cognitive bias, we're solving longitudinal data, or the gaps of not having this continuous piece of information about your health, how it gets lost when you move towns, interstate, don't even bother, like just start again, going to hospital, no records. And if you haven't been to hospital before, they're not going to have any records first time, but it doesn't mean you're not turning up with something serious. And yeah, so there's lots of changes we can make for people, patients, so that they have their own voice. And it's really important that people, they know themselves the best. They know the people they're caring for the best, and yet they're ignored constantly in the clinical process.
Yeah. And the interesting thing is, it wasn't for lack of diagnosis. It was just you were totally overwhelmed with all the different diagnoses coming from different people. And then because they couldn't quite put their finger on it, they just went, oh, well, it's just Michaela. It's just her age. And then you're sitting in a situation where you've got all of these seizures happening, and you're keeping a record of what day, what hour of the day, how long and all this. You're as a parent, you're the one keeping the record of what's actually happening with the patient.
Yes.
And there's nowhere to put that information. I think you mentioned to me you had like 20 or 200 pieces of paper all stapled together, stuck together, going, this is what's happening. And no one could figure that out.
Well, the first thing was, it wasn't that they all had a different opinion. She was diagnosed or misdiagnosed at week 4 with functional neurological disorder, which is kind of a condition. I think there'll be lots of people that understand this. It's it's a really difficult condition to diagnose. You can't do it in 4 weeks. But then every other doctor behind, and they didn't follow the process. I'm a process-driven person. They did not follow the clinical process to diagnose FND in the first place. And then every doctor thereafter, because she'd been labelled, oh, well, she's got FND, we can't do anything. So there was even no independent review process that was available or any doctor would question. Then it became, I'm sorry, I've forgotten the second part of what you were saying.
Well, the thing is, you've then got a catch-all. This is what we think she's got, and then everything else that doesn't fall into that is not even looked at. Yes.
And so this report, so I was collecting everything in an Excel spreadsheet, and you're right, it was 20 A4 pages all sticky taped together. You know, I was doing Gantt chart, not Gantt charts, I was doing pivot tables and categorizing, or able to demonstrate the tables in different colors to show deterioration of the increase in the number of seizures, increase in the length of time she was unconscious, increasing or decreasing the length of days between seizures. I had this, it was like a business report, like it was very impressive. And so I would turn up with my report and dismiss. So we talk about, and in health, we talk about how parents and carers and of patients are not listened to. So I was providing them with a very detailed summary of where they should be looking and why, and just dismiss. So that stuck with me for a long time. Actually, it still sticks with me because it was this dismissiveness of, all right, she's in the hospital now, therefore it's out, we'll take over, you just go and sit in the waiting room and grab a coffee. So, but that's not how continuous or continuity of health works, because you're losing information. yeah, so it was a interesting exercise, shall we say.
Yeah, I know when I left New Zealand to move to Australia in 2010, I did go to my doctor. I said, I want to take all my medical records with me, please. And it was like I was asking for them to send me to the moon. You know, they were, what do you mean? And I just assumed, I mean, it's 2010. We're talking, there's computers, the internet's around. And they gave me 2 big folders of paperwork. And I went, what the hell?
That was really generous of them. Normally you just get 3 pages.
So when I arrive in Australia, I go to the doctors, my local doctors, and I go, I'm here, I'm new, I'd like to get you up on as my doctor. Here's my records. And they looked at me again like I was speaking a foreign language, like, what do you want us to do with this stuff? So, you know, it's really interesting how the gaps in what you expect to be a system are so obvious when you start to very quickly poke holes in it. So so after you've written your book, you went, okay, I need to do more than this. How did you then leapfrog from, I need to do more, I need to give parents of children a bit more confidence that they can go and they can ask for things to be done and so on, to I'm going to make an app, right? I'm going to actually go and do something about this and put the health of people's children and their families in their own hands. What was it? Was it a light bulb moment, or what made you decide that?
No, I think technology, and I probably need to jump back now to 1993. In 1993, 94, 93, 94, summer 95, I was part of the first electronic banking team in the Commonwealth Bank. Now, we were installing into businesses cash management, so you could actually download on your computer, businesses could download bank statements, they could do direct credit transfers, they could do international money transfers. There's only 4 modules that were had been developed. And yeah, so, and I like the innovation and the excitement and being able to save the business's time. I was the first consultant who solved the problem for rent rolls, how to get a rent roll onto direct entry. And it's processes like, and then it gives the tech time to catch up to, you know, do their development. Then 6 months later, I was the consultant who did the first gym in Australia to do direct debit to your accounts. So, and I'd forgotten about all of these experiences that I'd had in technology from 30 odd years prior. But when it got to, 12 months ago, it had to be an app. It has to be in the patient's hand. It has to be mobile, so it goes with them. They can record. If they fall over and break their ankle, they take a photo. It's uploaded. And just going back to your, 1,000 pages of health notes, we have an AI analysis tool that scans everything in your file and converts it into a summary for the next time. I'm going to the doctors tomorrow. Give me highlight the most recent and your newest conditions, or where's the patterns, identify the patterns. So you walk in and you go, here's where I'm up to. So it should quicken the consultation time and give better outcomes. And if not, when patients are empowered to push back and go, no, I think, like the number of times my poor GP, I just go, because I know what I know now, no, I don't think so. I think we need to do it this way because my report is telling me this. And yeah, so God bless his soul. I'm typically right over the last 12 months. It supports Michaela's endocrinologist, who's amazing, but it provides context to the questions and the reality of, like, for example, they would ask her, how much do you eat? Or do you eat normally? And yes, I eat, I have dinner. And I'd sit there and I go, yeah, okay, now explain to them how big your dinner plate is. Or so in what should happen, you take a photo, the doctor should say, now I want you to take a photo of your dinner plate. Show me how much food you are eating. So if I wasn't there, the doctor would be under the perception that you eat dinner and that it's normal size. She was eating a bread and butter plate with about, a palm full of food. So once, and it means that people don't have to have their carers or that second person there every time. It gives some independence to people who are on NDIS, for example. Some not ownership, that's not the right word, but empowerment for being able to go to the doctors by themselves, knowing, and the carers knowing that, or parents or children, whoever it is, knowing that they've got all the information that they need and it can be transferred.
Yeah. What's the initial feedback been, Karen, from the people you're talking? I'm talking about the medical practitioners and people that you're working with. Has it been positive or negative or a mixture?
The clinicians, when they see it, overwhelmed. Why didn't we think of this before? Or because you're not the one experiencing the pain is my answer. There's one or two that go, oh, it won't fit. But, we've probably spoken to 30, 40 individually. The UK, we're probably having more impact. Some great conversations going on with organisations over there. And then our next phase product will fit and create that direct bridge for the clinicians. So they won't even need the PDF or a text of here's my report. That will help greatly in triage for emergencies, for example. We've got an emergency call button, emergency report function. You're in an accident, you press one button and up comes a whole profile, your allergies, what medications you're on, ready for paramedics, because paramedics turn up blind most of the time to sites. So it's that, able to share the most relevant information. We don't need the doctor's notes. We just need the high level, what's wrong with you? Is there anything they can see? Is there anything recent you've been reporting? Oh, I've been, having chest pain, or I've got a sore arm, tingly fingers. It'll be those clues that medical profession then can
brilliant. Because it used to be a Medicare bracelet we had in New Zealand. It was a bracelet you wore if you had an allergy or you were anaphylactic or whatever else. You'd have this thing with a code on it that they could put in and then go and see what you had. Whereas today, everyone's got their phones on them. So it makes so much sense to go, hey, where's your Mikare? Somebody's just fainted or somebody's fallen over or they're having some issue. Look at their phone and see what's on there. Right, this is the medication they're on right now. I can imagine it being a huge life-saving device in terms of knowing what you're dealing with and not going in there blind. You are listening to the That's Audacious podcast. If you like the conversation we're having, there are lots of other ones in other episodes. Please subscribe, like, and follow us. And, of course, you'll find us on all your favourite podcast channels. Karen, what made you decide in your very early stages, because we're talking about maybe a year, 18 months that this has been up and running and going, to go for awards for something that was so new?
So I had entered awards previously, and there was, through our conversations, you had shared there was the Stevie Awards, and I didn't think we were ready at that stage, but there was one award where it was about the product design, and it's like, yes, that's the award we need to go for. And we got a bronze from that award submission, which I was very proud of. It gave... it's really interesting. We didn't have a live product. We won this award for our design, fantastic, but it gave us leverage into other conversations because it gave us credibility that an independent body had judged us and had seen our product and the back end and screenshots of everything we were doing and had made an assessment that we, we're credible. And so it made people take us more seriously in those early days. So now we're ready for, different categories because we're at a different stage. But they're really important for business growth to credibility, leverage, to the business and the product.
The category that you won was actually best health tech product for women. It's like for or by women, and being a female founder, it made sense to enter that one, of course. and you are up against two big companies based, one in Tahoe City in California, the other in New York and US as well. Big tech AI companies who took out the gold and the silver, and there you are, a little old company from Australia with your own development of your own product that's only been around for such a short time, winning bronze. I always call a bronze a rose gold because people go, oh, I only won bronze. No, it's a rose gold, mate. It's you're right up there with these big companies. What's it been like since? Well, let's start off with the being there, because you came to New York to celebrate those awards, and you were there and in that environment with these other leading women in business and so on, and celebrating your success. What was it like to have that tangible moment where you were given that award and in that room of 500 or 700 amazing world leaders?
And it was before that I went up to receive the award. I was looking around the room, and you're right, there was, you look through the booklet, and there's these major companies, not just AI companies, but health companies that are international. And I was sitting there, I remember sitting there reflecting, going, oh my goodness, you're right, I'm a small team, an innovative solution to something that I thought was quite obvious, but we still are actually the holy grail, because we've not just focused on physical, we've been able to incorporate mental, social and environmental into the product. So, because health is not just physical, it's all of those four components. It was, I think you just need to take stock and reflect that you wouldn't have got here if it wasn't a worthy product, and to honor the work that you've done and the solution that you have, or the product that you have. I think awards neutralize businesses. It's irrelevant how big you are, how many staff you have. If you don't have in this category something that was innovative and health tech for women, then you weren't going to, you wouldn't be awarded anything.
Yeah, absolutely. It is interesting, isn't it? I think women in business especially, we are very focused on the now and the future. We very rarely stop to look at what we've actually achieved in the past. So it's that nice opportunity to do that. And what's it done since then? I mean, we're talking, where are we? Probably 5 or 6 months since you were awarded that. It's not long, but has there been any change in the way that you think about your business, or anything in terms of how have those awards maybe helped you?
I think it's added a layer of confidence that, and I remember pre the awards, I kept apologising for this innovative solution, nearly blaming Mikare for being sick as to, we had to do it because of what I found. To being, I think, a different mindset around where it sits, the value that it brings, the importance the place that it has in healthcare. Healthcare is so heavy in clinicians and process and regulations, and
thanks so much for listening to the That's Audacious podcast. And so then remember, there's no place for modesty in business, and you do deserve to be well known, well paid, and wanted. For more episodes, please subscribe to the podcast on your favourite channel, or follow us online. The links are in the description below.
It should be on our website. I better check that. It's just, I think it's given me the confidence to go, no, we are on the right track, and we have got something that's valuable to society.
Yeah, and is it opening those doors? I mean, you mentioned before you're doing very well in the UK. Has it sort of opened those doors as well, or helped you with those sorts of things?
I think the fact that it gave me the confidence to, and it's not like I didn't love this product. Like it was the new baby, but it gave me the confidence to stand there and go, this is something that you need. It's like that silent friend who's always there supporting you from behind, but doesn't actually necessarily have to attend the meeting with you. It was definitely a different relationship that I had with the award, and how I've then used it. In the next round of awards, I think I'll use them differently and leverage them differently. But this one was definitely about my confidence in standing alongside and knowing that I'm an equal to these big health companies. Because at the end of the day, if they're so clever, why didn't they think of it? Like that's if you really want to break it down. But we are innovative in our, we're not an app, we're an infrastructure layer. And so we actually had to change the terminology that we use for the product as well, because we kept getting dismissed. Oh, you're just an app. It's like, if I heard someone say that one more time. And then I actually looked back on some of the content of the award submission one day, and then we're talking about it internally. It's like, okay, we need to change. We're not just an app. We are an infrastructure layer in healthcare. When you step through the process of healthcare, from the patient right through to the good health or whatever the outcome is, we're a layer in achieving those solutions. So
brilliant. I love it. So if you're sitting on an innovative idea, don't wait to go for awards. Just get out there and do it, because you just never know where it'll take you. Now, we're coming to the end of this fabulous conversation. It's been so awesome to dig deeply into the origins of Mikare and where it's going and what it's doing and the impact that it can have. We always ask the same question of all of our guests. Karen, if you could go back in time to any point in time and give yourself some advice that would help you for where you are today, what would that advice be?
I would go back to electronic banking, and when I was looking at the coding, because it was MS-DOS in those days. You didn't just, download the file and drag and drop to your applications folder. It was MS-DOS coding. I would have taken more notice and not been afraid of breaking the computer.
Pushing the boundaries. How surprising that Karen Perks likes to push boundaries.
Very surprised. Thanks,
Common denominator. I love it. Look, Karen, it's been absolutely a blast to have you on the podcast. We could talk forever, but thank you so much for sharing your journey. Congratulations on your amazing success. It's such a vital tool. It's an amazing infrastructure for people's health, for their well-being. And for me, it's the future of that Medicare bracelet. Do you know what I mean? It's the obvious step forward for us, using the technology to the maximum to make sure that our health staff and the people who work in that industry have all the information at their fingertips so that they can treat their patients better and quicker and faster and get those solutions. So thank you very much. Well done. Congratulations. And remember, if you're listening to this podcast, you have the most amazing gifts and skills that the world needs, and you do deserve to be well-known, well-paid and wanted. We'll see you in the next one.
Thanks, Lauren.
Thanks so much for listening to the That's Audacious podcast. Remember, there's no place for modesty in business, and you do deserve to be well-known, well-paid and wanted. For more episodes, please subscribe to the podcast on your favourite channel or follow us online. The links are in the description below.